Wellness Wednesday, and today Dr. Quinn is going to help us tackle the often confusing world of insurance. Good morning, Dr. Quinn.
Good morning.
So what makes a good insurance plan?
Well, as a doctor that's been practicing for over 20 years, I've had so many scenarios where a patient's care was compromised because they did not have the better insurance plan. And what we want to do today is discuss 3 things that a patient should be aware of when they negotiate their insurance plan. Number 1, comprehensive coverage, meaning that if something were to happen and we had to refer them to another doctor, there's a high probability that doctor takes that same insurance. Or if they have to go to the hospital takes the insurance. Or if they have to go to rehabilitation or get certain medications, the insurance just is comprehensively covered across the board. That's very important when you negotiate your insurance with your insurance administrator.
Right.
Number 2, predictable cost. Like, a lot of people will get insurance and they don't understand that the copay may be different between a primary care and a specialist. And you want to kind of have an understanding. If you go to your primary care, you don't want the copay to be $50 or more. You want it to be $20 if possible.
Right.
If you go to a specialist, ideally $40. But some insurances don't do that, and it's not discussed when they acquire that specific plan. Lastly, you want to have as low as possible out-of-pocket expenses as possible. It's called your out-of-pocket deductible. And I've had a lot of cases where I've diagnosed certain things on patients. For instance, a patient with a very high prostate-specific antigen and wanted to refer him to a urologist for additional testing. But the problem was his out-of-pocket deductible might be $10,000, which he did not even have a clue about. He didn't negotiate when he acquired that insurance with the broker, and if he would have negotiated, it could have been much less. But the problem was the urologist wanted him to pay for the entire visit, including the diagnostic testing before he would see the patient. And
Wow.
that patient's treatment was delayed, and that could be very dangerous.
Absolutely, Dr. Quinn. Those are really good tips whenever you're thinking about insurance that honestly I would not think to even ask or look into before deciding your insurance. And what are the consequences of ignoring a good insurance?
Well, like I said, the consequences is you end up with an insurance that's less than optimal. And basically, you can have delayed care. Maybe you didn't negotiate the prices of the prescriptions, as far as if you need specific medications and you might not be able to get the medication that's most beneficial to you. Different specialists might not take the medicine. And if you have an untimely event, such as myself, I actually, we've talked about this. I suffered a diagnosis of brain cancer a few years ago. And because my wife and I, when we got our new insurance, when we got married, my best thing in my whole life, 7 years ago, we negotiated a better plan because I had a lot of knowledge working in the medical field for over 13 years at that time. And the hospital I needed to go to, the surgery, everything was in my network. The doctors, the rehabilitation, the radio and chemotherapy, everything was covered. My cost was literally $250,000 initially.
Wow.
But my negotiated rate with my insurance was all the way down to like $125,000, and I only had to pay a fraction because I had a very low out-of-pocket deductible. So all this information is so important when you choose your insurance.
Right.
And I understand a lot of people might not be able to afford the Cadillac plan, but you just have to do the best you can.